Who decides who gets the right to live? Euthanasia is a topic that has shown to be controversial worldwide. Assisted suicide is looked down upon by some in our country, even though other people believed it should be legalized. There have been countless court cases over the matter. There are many arguments such as respect, physicians' duties, and pressuring patients. Active euthanasia is viewed differently by everyone. That's why it is legal in some countries and not others, but it is a crime. In the world today, people expect respect, whether you're in the workplace or on a bus. So where does that leave euthanasia? For one, you should respect someone's opinion, but also show respect for that person's life. That is where the disagreement begins. It's their life, so they should have the say of what happens to it. But should a doctor be responsible for following that request? Which leads to another point. Should a doctor have the obligation to take away life in such manners? The law draws the line at not keeping people alive instead of lethal injection. It may be more drawn out, but the doctor isn't taking that life. This is where the Hippocratic Oath and the physician's take come into play. People try to interpret the Hippocratic Oath to tell them what they want to hear. Cheryl K. Smith, a former attorney, states, "The oath requires physicians to relieve pain as well as giving no deadly medicine." There is much controversy with that statement. In the oath, the physicians have to weigh the importance between suffering and taking someone's life. Who should be able to make that judgment call? Some patients that are terminally ill are not even able to communicate across what they want, or if they're truly in pain, or even how severe it is. Patients that would usually never think about it would have to consider it because it would be an option to them. And ultimately, it could sway their choice. Knowing that you're putting your family through such a hard time, you may feel guilty about time or money. Euthanasia.com stated that the Oregon assisted suicide case, 37% of people were concerned about burdening their families, friends, and caregivers. That also goes along. They said 84% feared of losing autonomy. 84 were concerned about decreasing ability to take part in enjoyable activities. 47 were concerned about losing control of bodily functions. And 26 feared inadequate pain relief. These were all fears that people had when they were going in for euthanasia, and that's the reasons why they did it. The Hippocratic Oath is essential there to help make things clear to the doctors of what is okay and what is not, similar to the law. Making a law these days goes two very different ways. It could clear up confusion so there would be nothing left for interpretation, which would prevent lawsuits. On the other hand, once something is legalized, it has a tendency to has legalization to similar things. This shows that if it is legalized, it will not stop at what is terminally ill. Once you get them to pass the law, why stop there? It is not a physician's job to take a life. They are supposed to preserve it. No one has the right to kill, even if it's the patient's choice. The definition of murder is the premeditated killing of one human being by another. Ultimately, it is murder, which is illegal. The American Medical Association said, instead of engaging in euthanasia, physicians must aggressively respond to the needs of the patients at the end of life. Patients should not be abandoned once it is determined the cure is impossible. Patients near the end of life must continue to receive emotional support, comfort care, adequate pain control, respect for patients' autonomy, and good communication. I agree with that statement 100%. There are not many facts behind the points made, but only because this topic is based upon opinion. I personally agree with active euthanasia not being legalized. There is not much of middle ground between these two ideas, so it is almost impossible to compromise. If we keep euthanasia illegal, we are not putting doctors in a bad position and not pressuring people into anything. There are three things that play a big role in the argument: are the opinions on respect for life and opinion, the consequences of making it legal, and the interpretation of the Hippocratic Oath. Even though euthanasia is legal in some countries, I firmly believe that it should not be legalized even if it is the patient's choice. A physician should not have to hold that responsibility.